Hello from WHO's offices in New York City. Good afternoon, good evening, good morning to all. Thanks for joining this press conference on UHC and tuberculosis. We're focusing on the high-level meetings at the UN General Assembly. The UHC, the Universal Health Coverage high-level meeting, is ongoing. The declaration was approved this morning by heads of state. And the tuberculosis high-level meeting is tomorrow, and the declaration will be taken up in the morning. So we're very lucky to have 4 experts with us. We have to my right, Dr. Bruce Aylward, Assistant Director General for Universal Health Coverage Life Course. Next to him is Dr. Jérôme Solomon, Assistant Director General for Communicable and Non-Communicable Diseases. On his right is Dr. Teresa Kasayeva, Director of the Global TB Program at WHO. And to her right is Dr. Matteo Zignol, who is Unit Head for Tuberculosis. So I just want to there's one bit of housekeeping, which is when we come to the media Q&A, it'll be important that you will have put your names correctly into the Zoom and your media outlets. So if you can do that now, when we come to the questions, we'll be able to call on you. So without further ado, I'm going to ask Bruce to say a few words and we'll go down the line. Thanks, and over to you, Bruce.
Thank you very much, Gabby, and good morning, good afternoon, good evening, wherever you may be in the world. Thank you so much for joining us. I've just come across the street from the UN General Assembly, where just 2 hours ago we had a particularly important, I'd say, historic declaration, a political declaration, and that was in the context of the high-level meeting on universal health coverage. The declaration was passed, which emphasized the need for urgent action to move the agenda on UHC, for political leaders to redouble efforts to move this agenda forward. I want to say a few words about the importance of the declaration with respect to timing, and then a few words about what's in the declaration. First, in terms of the timing, this is coming one half of the way toward the Sustainable Development Goals, really important. It's coming 4.5 months after the public health emergency of international concern on COVID was lifted. And it's coming probably most sobering 3 days after WHO and the World Bank released a report card on where we are in terms of the global commitment to achieve universal health coverage. And that sets a little bit the context, because that report card, some of you covered this on Monday, found that more than half the world's population, 4.5 billion people, do not have access to the most basic, essential of health services, or they're not covered by them. As alarming, 2 billion people, 1 in 4 people in this planet, suffer financial hardship when they try to access the health coverage or the health care that they need. That means they're making choices between, do they eat today, or do they get their medical condition treated or access to the services they need? So with a global commitment to a right to health, we need real action. And this is what today's meeting was all about. Now, the declaration was important because, first, there's a real human cost to not addressing this issue. As many of you will be aware, 800 women are dying every single day in pregnancy or childbirth. That number has not changed since we committed as a world to move that number, and it can't change without universal health coverage in place. 14,000 children under the age of 5 are dying every single day, and this is because of preventable diseases. And the real staggering number is 100,000 people dying of prematurely due to non-communicable diseases. And if we don't get that gap we talked about addressed, those numbers are going to continue and they may even grow. Now, what's in the declaration and that makes it important? First of all, it's the first time it takes stock, and this has been a shock. Often we pass these declarations, we move forward, and then at the very end, we look back and say, oh, we made some progress. This one after just 4 years, is looking at the situation saying we are way off track. So there's that context. And also coming out of COVID, a whole new understanding of the value people give to health and well-being and how far we are from having the systems in place. So it's an evidence-based assessment in the context of the pandemic and the challenges we face toward equity. So super important. The second thing that it did was it elevated some key issues since 2019. Some of these issues are specific health issues. Climate and health elevated, a massive issue, as you're all more than aware. Mental health, so much more cognizant of that challenge now coming out of the pandemic. But also issues like workforce, financing, health system resilience. We saw we didn't have resilient systems. Digital health, a crucial strategy as we go forward to move faster. Tech transfer. So there's a number of things which were elevated, building on 4 years of knowledge and, frankly, the costs we suffered in a pandemic. The other big thing it does is emphasizes key populations. It really highlights that universal health coverage really starts with the most vulnerable. The most vulnerable are the people suffering the financial catastrophic costs associated with access. And in those populations, we also have an emphasis on adolescents, 1.8 billion adolescents with very specific needs that aren't met and need to be met through universal health coverage. Migrants and refugees are emphasized. Folks, 1 billion people are on the move right now. They need healthcare to survive, to thrive, and that puts pressure on systems. So there's another big element. And a fourth big population emphasis is around indigenous peoples, both in terms of their needs and the knowledge they bring in terms of strengthening health. And then there's also an emphasis, we look at the third area in this declaration, that looks and recognizes you don't create health in the health sector. You create health in the food sectors, in the financial sectors, in the environment sectors, and that this is the reason there has to be the political leadership. It's not about commitment simply in health, it's across those sectors. And the last important thing that this declaration does is it takes that 4-year period and it looks at what works. And it gives a very compelling evidence that a primary healthcare approach on the path to UHC works. If we look at all the, if we tease apart those results in the global monitoring report released on Monday, it's not all doom and gloom. There are 30% of the countries that actually made progress in these areas, and they used what we call a primary healthcare approach, which number one, ensures equity. It looks at all peoples everywhere. How do you reach them all? First lens you look at things with. The second, cost effectiveness, inclusiveness, and efficiency. That is the crucial approach, which has been so successful, so many others, and has really been emphasized. Puts people at the center instead of hospitals and doctors, and it makes sure that their needs, that you're not treating the disease, as other one said, you're treating the patient. So that's a little bit about what happened this morning, and probably as impressive or more so than the declaration itself was then the lineup of heads of state, presidents and prime ministers who stood up and said, number one, this is important. Number two, we're making progress in our country. And number three, here's how we're doing it. President of Chile, the prime minister of Bangladesh, the prime minister of Japan, across a whole range of countries and more, stood up to say it's a primary healthcare approach. It works by putting our people first and putting their health first, because frankly, that's the purpose of us all being here, achieving health and well-being. Now, as we hand over to Jerome, who will say a few words, my colleague, Assistant Director General, health systems don't operate in the abstract. They have to be in place to tackle specific diseases. So if we're going to make progress on things, global challenges like tuberculosis, which will be addressed more at the high-level meetings, a strong health system is crucial. This is what it does. It helps solve those problems. Jerome.
Thank you. Thank you very much, dear Bruce. Good morning, good afternoon, and good evening. We are pleased to join you today from the sidelines of the 78th United Nations General Assembly in New York. Tomorrow, heads of state will come together to revitalize commitments and actions to accelerate efforts to end tuberculosis, or TB, at the UN high-level meeting on the fight against TB. Tuberculosis remains among the world's top infectious killers. Each day, around 4,000 people lose their lives to TB, and close to 30,000 people fall ill with this preventable and curable disease. Global efforts to combat TB have saved more than 75 million lives since the year 2000. However, the COVID-19 pandemic, coupled with conflicts across Europe, Africa, and the Middle East, and socio-economic inequities, has reversed years of progress made in the fight to end TB and placed an even heavier burden on those affected, especially the most vulnerable. This is why the prioritization of the TB in agenda of heads of states and other leaders at the high-level meeting is so important. It provides strong impetus to step up progress in countries against this ancient disease. Universal access to TB prevention and care as part of the UHC agenda, multi-sectoral actions to address drivers and determinants of the TB epidemic as part of the Sustainable Development Agenda, strengthening essential TB services as part of pandemic preparedness, prevention and response agenda, and advancing research and innovation are the key priorities to drive the End TB agenda forward. I would like to share some historic news. WHO Director General Dr. Tedros Adhanom Ghebreyesus officially launched the TB Vaccine Accelerator Council yesterday morning to facilitate the development, licensing, and use of new TB vaccines. The council, supported by the WHO Secretariat, will be led by a ministerial board. It's co-chaired by the health ministers of Brazil and Indonesia. BCG is currently the only licensed TB vaccine. It is 100 years old and does not adequately protect adolescents and adults who account for most TB transmission. This council will work to expand the development and testing of vaccine candidates, close financing gaps, and establish pathways to equitable and affordable access to vaccines. WHO estimates that over 25 years, a vaccine that is 50% effective in preventing TB disease among adolescents and adults could save 8.5 million lives. It would also reduce the need for antibiotic treatment and save billions of dollars in costs faced by TB-affected households, most of whom are poor and vulnerable. The COVID-19 pandemic demonstrated what is possible, that with political and financial commitment, new and powerful vaccines can be developed quickly and distributed widely. We believe that the commitments from leaders and the work of the Vaccine Accelerator Council can help speed up progress in the fight against TB. I now turn to Dr. Teresa Keseva, Director of WHO's Global TB Program.
Thank you, Dr. Sharon. Dear colleagues, as we all look ahead to the UN high-level meeting on tuberculosis tomorrow, I would like to share WHO's latest stocktake of progress made towards achieving the commitments made by the world leaders in 2018 when they met for the first time. We know very well about the devastating impact of COVID-19 pandemic, and it's presented, described in the UN Secretary General report. But however, due to the huge efforts by the member states and partners, of course, with the support of WHO, still progress was achieved. Based on data compiled by WHO's Global TB Program from more than 200 member states in annual rounds of data collection, here is a status update. First, member states committed to treating 40 million people for TB between 2018 and 2022, including people with a drug-resistant form of TB and children. A total of 34 million people were treated for this period of time, representing 84% of the cumulative 5-year target. Globally, progress towards meeting these targets, and especially targets of treating 1.5 million people with a multi-drug resistant or rifampicin-resistant TB, reached only 55%. And you know all very well that this is the most severe and dangerous form and contributor to the global problem of antimicrobial resistance. The total number of children receiving TB treatment was 2.5 million, representing 71% of the target. Although the proportion of children with multi-drug resistant TB who received treatment remained very low. Second, member states committed to provide TB preventive treatment to 30 million people for the same period of time, including people living with HIV and the contacts of TB patients. A total of 15.5 million received TB preventive treatment, representing only 52% of the target. Most of these were people living with HIV. As you know, WHO recommends TB preventive treatment for people living with HIV, the household contacts of those who have bacteriologically confirmed pulmonary TB, and clinical risk groups like people who are receiving dialysis. At the subpopulation level, the targets of providing preventive treatment for 6 million people living with HIV was reached ahead in 2020, and it clearly shows when there is enough prioritization and investments, these targets are reasonable. In contrast, only 55% of the target set for the number of household contacts under the age of 5 receiving preventive treatment was met, and only 10% of the adults who needed TB preventive treatment. As you know, it's easier to prevent a disease. Third, expanding coverage of high-quality TB prevention, diagnosis, treatment, and care services requires adequate and sustained investment. Funding for TB services in low and middle income countries was 6.4 billion in 2018, but decreased to 5.8 billion in 2022. This amount fell far short of the target set of at least 13 billion per year by 2022. Overall, close to 80% of funding was from domestic resources in 2022, similar to previous years. Since 2050, funding from international donors has been around 1 billion per year, with approximately 2/3 of this total coming from the Global Fund, and with the government of the United States of America being the largest bilateral donor for TB. Funding for TB research remaining very limited, maximum up to 1 billion annually. However, this amount was just half of the target set for the period up to 2022. The biggest contributors here are, again, government of the United States and the Bill and Melinda Gates Foundations. Uniting around the TB response by world leaders for the second time provides an opportunity to accelerate actions and strengthen health system capable of not only addressing TB epidemic, but also considering TB as the part of health system strengthening and effective pandemic preparedness response. We look forward to the commitments and targets that we see in the political declaration that will be presented tomorrow for approval. The targets include reaching 90% of people with TB prevention and care services for the next 5 years, using WHO recommended rapid tests as the first method of diagnosis TB, providing social benefit packages to all people with TB, licensing at least one new TB vaccine, and closing funding gaps for TB implementation and research by 2027. It is informed by WHO's call to countries, partners, and other stakeholders through our flagship initiative for the next 5 years. We look forward to highest level participation of governments in the UN high-level meeting tomorrow, along with the key civil society partners, and for commitments to redouble efforts to ensure all people with TB access quality prevention and care in line with WHO drive towards universal health coverage. Thank you.
Thank you, Dr. Kasayeva. Teresa, And now we're going to go to media Q&A. Again, raise your hand in the Zoom or type into the chat if you have a question, and make sure you're identified on the Zoom with your media outlet. We do have a question from Banjot Kaur at The Wire, India. Do you want to come on screen and ask your question, or do it via audio? Over to you.
I would do by audio if that's okay.
Sure, go for it. Thanks.
Thank you. Thank you for taking my question. My question is to Dr. Teresa. Dr. Teresa, I hope you must be aware of stock out of essential drugs for drug-resistant TB patients in India for quite a while now. I understand the WHO team has gone down to 4 states of India to understand the situation on the ground. Could you please share which were these 4 states and what were the findings? And overall, what is WHO's assessment of the situation, especially because it's about access to drugs and also about the universal healthcare coverage, which has been talked about now. Thank you so much.
Thank you very much for your questions. Yes, of course, we are aware and noted with the concern the recent reports on the shortage of TB drugs affecting some facilities and provinces in India. And you're absolutely right. Our colleagues from WHO country offices and regional offices are closely following these situations and visiting states and facilities. And this is still ongoing process. It's not finalized. Once all the comprehensive assessment will be done, of course, we will share the information and findings, but also we hope, because we are working closely with the government and partners, that this unfortunate situation will be sorted out quite soon, as we've been promised, and hopefully by the end of this month, beginning of the next. But we will keep you informed about the findings and ways to prevent these situations in future.
Great, thank you. And we're going to pass the microphone back to me temporarily. We have a question from Carmen Pawn at Politico. Over to you, Carmen.
Thank you so much. There's been some confusion among some of us regarding the approval and the adoption of the declarations on health. So I understand that, both declarations on universal healthcare and yesterday on pandemic preparedness were approved at the meetings. But is there one more hurdle to clear at the General Assembly? And given that there was opposition from about a dozen countries to them, does it mean that they might actually end up not being adopted? If you can clarify that for us, because I think there's been quite a bit of confusion reigning over that over the past few days. Thank you.
Good question, Carmen. Bruce will take this one.
Thanks. Hi, Carmen, and thanks for the question. Indeed, there's one more step. What happens in high-level meetings is that the body, the assembled member states, they approve a declaration, but it then actually has to be formally adopted at the assembly itself. So when we talk about a hurdle, Carmen, the high hurdle has been passed, and then there's a lower hurdle, let's say, for adoption. Now, things can happen, obviously, between now and the time it goes to the assembly floor. But generally what might happen there is there's general consensus, and people may decide that they dissociate with specific, or countries, pardon me, with specific let's say, provisions within a declaration, and the members, they won't be, will basically be saying, well, we agree with the declaration, but we dissociate ourselves or won't be held to this specific issue for which we have a difference. And, that does not dilute. I think is really important to recognize what's been achieved here today, because when you go through this declaration, the vast majority of it has strong support from all of the members, right? And there's super strong support around the fact that this is the highest priority of government. Generate health and well-being for your populations. And number 2, this requires political, not just leadership, but action, because it isn't you don't create health just in the health sector. So broad agreement on these things, that we have to rethink how we finance health. It has got to be a top fiscal priority. There has to be public sector spending on it. You cannot solve it with private sector, and that's to protect the most vulnerable, another important piece. And you have to have the people. We're coming out of a pandemic with badly scarred economies, yes, but also badly scarred health systems and health workers. We have an estimated best case scenario, 10 million health worker gap by the end of 2030. And without the workers, you simply can't deliver the health services as well. So there's real clarity around all those big, meaty issues and real consensus, as well as a number of the others I spoke to earlier, won't repeat myself on. So this is a really important achievement today. It's just I think people are shocked, but when they are looking at the numbers and the gaps in terms of achieving this goal, and they're also looking at the fact that actually it's not the same in all countries. Some countries are making real progress on delivering affordable care or accessible care for their entire population. So it's a really important point we're at.
Thanks, Bruce. And we actually have a question we got via email that's related to the declaration, actually, and it's relevant, and perhaps Jérôme and Teresa want to take it, which is, how will these declarations concretely accelerate progress, for instance, in helping TB patients? So I think journalists both want to understand the process around the declarations, but also how do you connect declarations with actual outcomes in the real world? Teresa? Oh, here's the microphone.
Moving mic.
Moving mic.
Yes, happy to have this question. Actually, this is a core, and this is our aim. But a fight with TB will not happen on paper and in the declarations, but these strong commitments should be translated into the actions. And we are very happy to have concrete numerical targets for 5 years addressing very important aspects of TB care. And now there could not be any excuse, once we will receive these highest level commitments, that these commitments will not be translated into the concrete actions. 90% minimum of treatment and preventive treatment coverage should be reflected in the national TB programs and health sector programs, and also with adequate funding for these specific needs, following the best available standards for treatment and diagnosis. And we as WHO will be closely following, monitoring, giving necessary technical expertise and advice to assess and support member states move these directions. It's doable, it's possible, and we are very optimistic because after first high-level meeting and adoption of its declaration, we've seen really fantastic progress during the first 2 years. Unfortunately, then pandemic happened and we've been pushed back. But it's possible, doable, and we are ready to stand together with the partners to support countries to achieve. What we need political will and adequate response to these commitments.
Great. And Jérôme, you want to jump in?
No, just to say that really that's a political commitment, and that's very important related to UHC, PHC, and of course PPPR, because tuberculosis is what we call endemic, which is a pandemic without any end. So this disease needs really a very strong commitment of all actors. We are working with NGOs, we are working with civil society. We also have strong voices of people with lived experience. We're working, of course, with young people and with you all from the press, because we need to advertise about the feasibility of fighting TB and ending TB. So really, it's a strong commitment. But on the fields, we need to give access to excellent diagnostic, new treatments, and of course new vaccines, because there is a strong hope of having new efficient vaccines in the next 5 to 10 years.
You actually just answered a question we had received online about when we can expect a TB vaccine. So thank you for that. And we have another online question, which is probably for all of you. How can countries ensure that TB is well integrated into primary care and the whole health system, and not addressed in isolation from the other diseases? This is a great question because it's about making sure health is horizontal and cross-cutting. Who would like to take that first?
I'm sure Bruce have many things to say, but just to say that, we are now in front of a radical reorientation. We were building strong health system, center to systems. Now we want to have a people-centered system, which means we need UHC, of course, but PHC. And what is primary healthcare? It's concretely the list of essential services, essential devices, essential drugs, essential vaccines that you can ask for when you enter a primary healthcare center, for example, or when you are in your country hospital or regional hospital. So that's very concrete, and it means, for example, for TB, that in all regions, in all countries, you should have access to excellent new devices, that you have access to TB prevention, but also to TB cure, and that you will have access to the new vaccines that we really hope to see in the next few years.
Yeah, Jerome nailed it. And this is not a question about TB, or HIV or maternal health. It's the same for all of these, and it really comes down to making sure you treat the patient and not the disease. When, as Jerome referred to, a couple of months ago in May, the other thing which happened, of course, at the World Health Assembly was 194 countries agreed to the radical reorientation of their health systems to a primary healthcare approach. And that did exactly what Jerome said. But when we think about something, you have to think, well, where is it coming from? And the problem we have right now is that many health systems, they're hospital focused, big investments in hospitals, and then, or they are disease focused, treat TB or do immunization or do that. And the big shift, a part of the big shift, is to be person focused and people focused, because people do not come in as a disease. They come in with a whole range of issues that concern them that have to be addressed. So that integrated approach is absolutely crucial. And the other thing is, a hospital-centered or a disease-focused system is, number one, incomplete, and number two, it's inefficient, and it's increasingly an unaffordable way to try and create health and well-being. And hence, the approach has got to be integrated. Now, that said, when we look in WHO, how well is our work on a health systems working, or how well is our work on workforce working, we look at what's happening with TB, what's happening with HIV, what's happening with maternal mortality, or the risk of a woman dying in pregnancy or childbirth, because those are the key indicators that tell us, are the systems that we're talking about, the shift to primary healthcare, is it actually working? Because it's got to result in real results for people.
Oh, over to you, Teresa. Pass the mic.
Yes, to contribute to this important question. And coming back again to TB, I would say that we can definitely understand and measure and monitor assess the status of the integration on TB into the health system, into the primary health care, and accessibility due to a very well established system, as I've told, in 200 countries. And I would like to refer you to our app version of the Global TB report, where you can clearly see if the TB treatment coverage is low, when the screening for TB infection is low, when access to TB diagnostics, as it is now globally, less than 30%, these are clear indicators that TB services are not embedded into the primary healthcare services, are not considered as essential at the closest accessible level. So that's why it could be monitored, it could be brought to the attention, and we have all the clear guidance how this situation should be addressed in different countries. So what we need, again, I will repeat, will and prioritization, because still tuberculosis remain one of the biggest infectious disease killers in the world, and it's preventable and curable disease.
Thank you, Teresa. We are way past time, way past our 30 minutes, and our experts need to get to their next meetings here in New York at the UN General Assembly. I just want to reiterate that what Teresa said, which is TB is preventable, and we need political will and investment, and also that together the world needs to drive toward universal health coverage, because health is a human right. So with that, I'm going to thank all the journalists who joined us today. And we will be sending you links to this press conference and some other materials, such as the TB report that Teresa mentioned. And of course, you know how to reach us if you have any further questions. So have a great day. Thank you. And thank you to our experts, Bruce, Jerome, and Teresa. Do you want to add something? No. Okay, good. And with that, go and have a good day. Thanks again, and see you at our next presser.